Welcome to the Fair Lawn Chamber of Commerce Business Spotlight, where we introduce local businesses to the community and the world at large via social media. Today's guest is John Maggio. He's a therapist and program director for ChoicePoint, a behavioral health and wellness facility new to Fair Lawn. Hi, John. Thank you for joining us today.
Thank you for having me.
It's my pleasure. It's wonderful that you're a new business in the town of Fair Lawn, and it's great to have you. I think, having a health and wellness facility here is very important. Could you tell us something about your company and some of the services that you provide?
Yes. So we are new to Fair Lawn. We are located right off Route 208. We are a behavioral health and wellness facility. Just as you stated, we focus mainly on co-occurring treatment. So we focus on substance use treatment like addictions, as well as mental health treatment. And we could also treat both of them at the same time if needed.
Great. And tell us, how old is your company? I understand it's a brand new company, correct?
We are brand new. Our company is new. We are comprised, however, of veterans in the wellness space.
Okay, veterans. So who actually, who are the owners, or would you say the CEOs of the company?
So our CEO, Ryan Casca, is our governing authority and our leader. He is excellent in the behavioral health executive space. He is extremely knowledgeable. He has a very high ethical standard. And I was very happy when he asked me to be part of this amazing project.
That's great. So tell us a little bit more about what you do. What's the actual service providers? This is for substance abuse, I understand, correct?
Yes, we are a substance use disorder treatment facility. We treat all substance use disorders on an outpatient basis. So we offer different levels of care from your basic outpatient level, which could be, therapy once a week, counseling once a week, maybe a group, all the way to intensive outpatient, which is a minimum of 9 hours per week. Usually 3 days per week for 3 hours per day. It also has another individual aspect to it, counseling and therapy. And then we also have the medical services. So we have a ambulatory detoxification, which is an outpatient detoxification center where we medically manage people who need to detoxify from addictive substances under the supervision of medical professionals and stabilize them sufficiently so they can continue on working, go home at night, be with their family, do the things that they have to do if they are not able to go in inpatient treatment.
Great. And you talk about what kind of drugs? Is this all kind of drugs, alcohol, cocaine? Does it matter? I'm sure it matters, but to be admitted to your programs, what kind of drugs are these people taking?
We treat all substances, and I think that's important in today's modern times with access to so many different traditional substances, plus research chemicals and unknown substances coming from, different parts of the country and easily accessible, through the internet. So we treat all addictive substances, and we have ambulatory detoxifications for the ones that require detoxification that are also not dangerous to do on an outpatient basis. Some people may require inpatient medical monitoring if they're at risk for seizures and things, but mainly opioids, which are, things like heroin and painkillers and such, cocaine, marijuana, alcohol, really any substance that one wants to stop using. We help you look at your relationship with it, remove it from your body physically, and then help you build coping skills to really facilitate a change to live a happy and healthy life.
Mm-hmm. So obviously you can't go cold turkey. So is that why they come to you? So they could, you said, so they could go back to their families. So you're really doing therapy with them so they understand how bad it is. Don't a lot of people that are on drugs like this, are they in self-denial? How do they come to your facility? Are they being prescribed from their doctors, their wives, their husbands, family members, or do a lot of them also come on their own?
So the route that they take to get here differs greatly from patient to patient. Some are at their, so-called rock bottom, although in this stage, rock bottom usually means death. So they're at their rock bottom where they are either, being pressured by some outside source. So, some sort of court system, a family member, a doctor, a healthcare professional, maybe their mental health therapist, things of that nature. Other people walk in through the door or call us and they say, I need help, and, I know I need help. Other people may have, had an accident or an overdose and are being referred from a hospital. So they come from all over, all walks of life, and we hope to deliver those high quality services to anyone seeking them.
So somebody that might be on drugs like this, how do they afford a service like this? Is it through health insurance? Most of them might not have health insurance. So could you tell us how they would pay for these services?
Yes. So, of course, we have a sliding scale fee if somebody did not have any coverage. The fee does start at zero and goes up to our full price. However, we take all different forms of insurance, such as Medicaid. We also take private insurance, and we are working every day with insurance companies to make sure that our services are covered and also that they allow everybody the same access to these high quality services, regardless of what type of insurance you have. So many people who have, let's say, a lower cost policy or public funding, they feel that they are not entitled to high quality services. And we really want to show them that they are, that they deserve to have licensed treatment professionals and full medical doctors helping them facilitate their change and wellness, and really providing this easy access to treatment to everybody, regardless of their physical location, regardless of their socioeconomic background, or any other, demographic or identifying piece of information. It's wellness for all.
Yeah, that's really terrific. So it seems to me a lot of times, I know someone or heard of somebody that as they're weaning off, they might go from an opioid or heroin to, say, methadone. Now they're on methadone for a while. That could also go for a long time. I know just somebody that has been on methadone, say, for the last 30 years. And some of the family members on one side are saying, that's really bad. The other ones are saying, at least he's being taken care of. What's the sliding scale of that, of recovery, or really getting them off of everything? Because I don't believe being on methadone for 40 years is a great thing either. So give us
what I tell all of my clients and all of my patients is don't let other people define your sobriety. So you may have an abstinence-based model, and there are people who can go cold turkey. You may have an uncle or a grandparent who just decided to quit cigarettes one day, or you might have a friend who, after years of opioid use, their doctor ended their prescription and they were able to easily, wean off and discontinue the use. And then other people may need therapeutic approaches, so clinical approaches like counseling and therapy. Other people may need medication-assisted treatment, which is things like methadone, Suboxone, Vivitrol, which is an injectable that blocks the use or the feeling of opioids. So there are tons of options, and our goal here is to provide all of these options because we really believe that having a person-centered and tailored treatment plan is very important to progressing and maintaining the progress towards the individual's goals. So towards the person who's seeking treatment, their goals are really what we're trying to build objectives to accomplish. So, I tell people that their route to sobriety is their own journey. And like you said, it is a full continuum. So what's keeping them sober today may not be keeping them sober 30 years from now. And hopefully we're building skills that maybe needed refreshing or maybe they never had to live a happy and healthy life, throughout the rest of their life. So helping them in the moment, allowing them to build skills to carry their goals through the future.
But it seems like the addict, or whatever you want to call them, the let's just call them the patient, it's a lot of work on their part too, right? So they could get the help, but if they don't keep it up or they don't take it seriously enough, and they could slip back, they could come back, do better, then slip back. So it's an ongoing process with it. How long do these treatments do you take them in? Is it a 3-month program, 6-month, or whatever they need?
It is whatever they need. So certain aspects of our program do have guidelines for the duration. So you wouldn't keep somebody in detoxification for months on end, right? As soon as the substances or they are stabilized, and they can move throughout their continuum of care, down a phase. If they require more services, they can move back up a phase. And, we really do, and I do like the word, like you said, patients, clients, people with substance use disorders, mental health disorders, all people seeking treatment for these substance use disorders will inevitably follow a continuum of care. And ideally, if all you do is stop the substance and you don't change anything about your life, so the people you hang out with or socialize with, the places you go, if you're trying to quit drinking and you still have a full bar in your house, that might make it difficult. So really telling them, aspects of their life that may hinder their progress and allowing them to make changes towards these aspects in order to facilitate their sobriety.
No, that's excellent.
Sobriety.
Yeah. What you're saying is so true, because if you don't take the person out of the situation, it's one thing to get them off the drug or start weaning them off. But if they're still hanging out with the same friends on the street corner, this and that, it's got to be very hard for them to break that totally. I mean, it might also be a spouse that also has a problem or is not controlled. A lot of spouses may not not that they want to help you, but they'll be in self-denial. Oh, well, he's okay, or she's okay. She's not doing so. She only does a little bit. I've been trying. I don't know what to do. Do you bring the spouse, or I don't like to say spouse, but maybe a partner in? Maybe not into the therapy, but how do you deal with that? Because that could be the problem, or that also could be the help that person needs.
Right. So everything could be helpful or not helpful, productive or unproductive. So if it is productive, we do encourage the individual to incorporate family or some sort of collateral into their treatment effort. So we will encourage monthly family treatment sessions. They are important to allow everybody to be on the same page, to really help others understand the process of recovery. And then we also, if the individual does not feel comfortable, or as you said, their spouse or family member or roommate, whoever it is, may be hindering their progress, so we'll help them modify the boundaries of that relationship so that the relationship no longer hinders their growth.
Right. Now, let me ask you about New Jersey itself. New Jersey is obviously right next to New York, Philadelphia. We spoke a little bit about this before we got online. It seems like New Jersey has a big problem of drugs, opioids, etc. And I heard somewhere in New Jersey, I'm not sure the exact area, that we're one of the highest in drug abuse here. Could you tell us a little bit about that?
Yes. So our geographic location next to major cities, New York and Philadelphia, like we were talking about earlier, or in between, I should say, and just being, in the Northeast in general, we do have quite a high population here, and there is easy access to substances for people who want them. So really, like you said, it is a problem in New Jersey. However, it's a problem everywhere. It's a problem in, urban communities. It's a problem in suburban communities, and it's a problem even in rural communities. There is easy access to substances, no matter where you go, really anywhere in the country. But yes, New Jersey has been hit specifically with the opioid epidemic pretty hard. We have lost thousands and thousands and thousands of our citizens to, this terrible disease, terrible disorder, that if we look a little bit more at the demand for the substance rather than the supply of it, we can have even more impact on the use. And people are doing a great job on the supply, law enforcement. There's, judicial systems, politicians, private companies, pharmaceutical companies, clinicians, all getting involved to address the supply chain. And really what we also want to do is address the demand. So why are people demanding these substances in such high quantities? And addressing both is really what's going to be the thing that pulls us out of this situation. Because there's nearly 100,000 deaths last year. They are forecasting many more in the upcoming year. And as we were talking a little bit earlier, the types of drugs are changing and are more volatile with less regulation.
With lesser regulation. So without getting political, of course, do you feel that the government is doing enough to stop the drugs from coming in? You said we're in New York, but aren't they coming through the borders with the cartels and this and that? Are we doing enough to prevent it from coming in? And then we'll get to the abuse on the demand. So the supply, are we doing enough to stop that supply from getting in?
I think we are doing enough because there's not a lot we can do. Drugs, illegal substances, illegal materials have been coming into all nations illegally any way they can for quite some time. And as soon as one way ends, another way begins. And the people on the front line at the borders, at major, shipping ports and things like that are really doing a very good job. However, packaging and the substances themselves are changing. So what used to be, filling a container ship or, a large container on a container ship now fits into maybe a small box that you can send through the mail, because these chemicals are 100 or 1,000 times more powerful than their older counterparts. So things like fentanyl being much more powerful than morphine or heroin, does change these things for people, protecting or trying to manage the supply. So like I said, we really do need to keep addressing the supply, but also really focus on the demand. Why are people using these substances? Can we do more to increase access to treatment? If somebody were to get addicted to them, how are they getting addicted to them? And we were talking a little bit about how a lot of the major pharmaceutical companies have changed their policies with marketing the substances, with prescribing. Doctors have changed their protocols with prescribing the substances, which has taken painkillers and prescription medications off the market for the most part, however, left a vacuum. And now we're seeing these essentially counterfeit substances or synthetic substances being counterfeit into prescription medications, things like diacetylmorphine, heroin. And we are, in essence, making the drugs a little bit more dangerous by limiting the supply of the prescription version of that substance. So the one that was made in a lab in a factory with high quality control is addictive. There's no question about it. It's dangerous. You could obviously overdose from it. However, the fake version of it, with the synthetic version or more powerful synthetic analog of that chemical, is no question more dangerous.
Yeah, you mentioned that. So there's a couple of key points you mentioned. The synthetic substitute. So if somebody was addicted to opioids or heroin, now they could get fentanyl, and you said that that's a lot stronger. So you gave me an analogy before we got on the air. If you could do tell our audience about that, where you said it's so much stronger that they need so much less of it, and that's why it could be dangerous. Tell us about that.
Yes. So when we were talking earlier, and this is a very common thing I often do get asked, why are these substances so dangerous these days? And well, they are way more powerful than the original substance than they are trying to mimic. And that being the case, much less of it is needed. And then just by default, much less of a dose is lethal. So if I were to take an active ingredient like a synthetic opioid, and I were trying to mimic something like heroin or a painkiller, I would have to take an inert powder and then mix the active ingredient into it. And if I don't do that evenly and consistently throughout, there will be higher concentrations of the active ingredient in different bags or different pills, and I will put the consumer at risk. So it would be similar to, I think the analogy I gave you was if I were making a cake and I had 3 cups of flour and a cup of sugar, mixing those evenly is not too difficult. If I had 3 cups of flour and a 1/4 teaspoon of sugar, trying to get that evenly distributed, much more difficult.
So is the end user, do they, I guess they know the difference, but if they're looking for a heroin high, now they got a fentanyl high, do they really care? Is it less money? Is it more money? Or they're just looking, whatever, they're just addicted to that high, I guess.
So there are people who do know they are doing fentanyl. There are people who are being tricked into doing fentanyl. There are people who are not sure what they're doing. And really they are going to seek a substance to kind of get them through the day. So maybe their normal supplier is not available. And as you said, the withdrawal symptoms are pretty severe. So seeking a temporary fix, so to speak, to get you through that hump could be extremely dangerous, especially if you don't know the source or the active ingredient or any of the other important information you would need to ensure that that substance is safe to consume.
You mentioned one other thing, and then we'll move on, was also prescriptions from doctors. Of course, the doctors are not prescribing them so you get addicted, but you have a back operation, you have spine therapy, they give you the oxycodone or something stronger, something with cocaine in it. And then people find it hard to get off. I know I had surgery. I found it hard to get on. I took it once and it was enough. I'd rather have some pain than, go through what that drug was doing. So do you think it's a problem? I don't want to blame doctors, but, easy access to oxycodone. So many people got addicted to that particular.
Yes. So we can't really blame anybody. Unfortunately, it was a perfect storm of misinformation, marketing tactics, reinforced behaviors. And yes, now we are fully aware that these substances, these painkillers, are addictive. Doctors are receiving adequate training now on alternatives to opioid pain treatment. So you are able to treat pain with substances that are not opioids. You are also able to do different things to reduce the need for these prescription painkillers, such as preventative medicine, physical therapy, and things like that. There is no questions that painkillers in general are a necessity. They are extremely important for people, like you said, receiving something like a major back surgery, end of life treatment, things like that. We just need to make sure that the person being prescribed them is fully aware of the possible side effects, addiction to the substance or dependence on the substance being one of them, and aware of also what to expect when they stop taking the substance. Because if you do anything for a couple months or a year, when you stop doing it, it's going to be a major change. So having support in making that change is also very important. So I never tell people whether substances are good or bad, because it's very person specific. What's good for me may be bad for you. So, if I have an anxiety disorder and I take an anxiety medication, well, that's going to help me live a very normal life, right? I like to say normal, but really it's going to give me a higher quality of life. If somebody who takes that same medication who does not have an anxiety issue, it may actually hinder their goals and give them a lower quality of life. So like I said, everything is very person specific, but really informing people of all of the information needed to make an informed decision is very important. And limiting the supply to those who need it is also very important, and something they are doing with everything from prescription monitoring systems. Databases where you can, see what's people are filling in other states even, all the way to training healthcare professionals to really, have alternative treatments to pain. Because it is true that in this modern time, we shouldn't have to be suffering, but sometimes self-defeating systems are not the answer. So something like an opioid for long-term treatment, you will build tolerance. Eventually, you will hit a point where it's not really doing much for the pain, and you're having to take so much to get that effect that you will have to eventually find something else either way. So really, I think education and prevention are the most important things that we can be doing.
Let me ask you, with the current pandemic, the COVID virus pandemic, do you see that there was an uptick in abuse?
Yes. So for some, yes. For some, no. It was a experience that isolated a lot of people. And isolation and lack of human contact is a risk factor for anybody trying to facilitate their wellness, whether emotional well-being, trying to stop using a specific substance. And it was a very trying time for a lot of people. I do believe that there will be some rebound when the pandemic slows down, as it is starting to slow down. People are getting more comfortable in coming out, and there will be more celebrations and things like that. We are also seeing a lot more changes in laws surrounding some substances. So we do think there is going to be a change in the pattern of use, but we are ready to address this as we are both in person here in beautiful Fair Lawn, as well as online, offering telehealth services to anybody throughout the state. So if they are curious about treatment, or they want a low-risk way to get an evaluation from a licensed professional, they could, of course, sign on from any device and be able to speak to somebody experienced in what they're trying to change from anywhere in the state.
That's great. Before we close out, you're so well versed in this, and you speak so wonderfully and specifically about this topic. What is your background?
So I'm a licensed clinical alcohol and drug counselor. I'm also a mental health counselor. I have been in the wellness space in some form for over a decade. I actually started at the Bergen County Office of Alcohol and Drug Dependency as an IT intern, working with computers. I built their digital of care, the digital continuum of care directory. And while I was there, I realized I might be in the wrong field. I switched my majors. I went to an undergraduate degree at Rutgers for psychology. And then I have a master's degree in clinical mental health counseling with a concentration of addictions from Montclair State University right over here. And I've been a counselor or therapist since 2012. And I've been focusing on substance use and mental health treatment, co-occurring treatment since 2014.
Terrific credentials. I'd like to thank you for joining us today and welcome you into our community. I know you joined the Fair Lawn Chamber of Commerce, so you're a brand new member of the Chamber. Is that correct?
Yes, brand new. We feel really welcomed by the town. As a longtime Bergen County resident, I've always, thought this area has always been a great region of the state. And I wanted to really bring these high quality services here and then offer them throughout the rest of the state and inevitably to everyone.
John Maggio, who's a therapist and program director for ChoicePoint, a behavioral health and wellness facility brand new in Fair Lawn. Thank you very much for joining us today.
Thank you. Take care.
My pleasure. So if you do need help or you're not sure if you need help, ChoicePoint is the choice for you. How's that for a new keywords?
I love it.
ChoicePoint is the choice for you. I'd like to thank you and really welcome you into our community. Thank you very much, John Maggio.
Thank you.
Right. This has been the Fair Lawn Chamber of Commerce Business Spotlight. My name is Alan Cohen on the Board of Directors for the Fair Lawn Chamber of Commerce, and it's my pleasure to bring these interviews to you. Thank you.